Hey everyone, there's about 5 students left that are moving in, but let me just go ahead and introduce myself. Again, my name is Felicia T. I am an academic advisor for the College of Health and Human Sciences Student Success Center, and I'm also the liaison for the Public Health and Recreation Department. Congratulations again on your acceptance and admissions to San Jose State University, and there you go. I killed enough time already. So everyone should be here now. And to start this presentation for public health, I'd like to introduce you to the chair of the Public Health and Recreation Department, Dr. Yoshi Iwasaki. Hi, Dr. Yoshi, how are you?
Hi, good. How are you, Tarisha?
Fine, thanks. So I'll go ahead and turn it over to you, but
Yeah.
I'm here if you need me.
Thank you. Thank you so much. And good afternoon. And thank you so much for joining us. Hope you are safe and well. So my name is Yoshi Iwasaki. I'm a professor and the chair of the Department of Public Health and Recreation. And in terms of my career, I started my academic career in 1998. So I'm now finishing my 23rd year working within higher education systems in the States and Canada. And I will be starting the 4th year as a department chair from the fall of 2021. So first, on behalf of the Department of Public Health and Recreation at SCSU, we would like to extend our sincere congratulations to all of you on your admission into San Jose State University, which is in the process of exciting transformation. So on that note, I would like to welcome all of you to the Department of Public Health and Recreation at SSU. Now, to get us started, I would like to check in with all of you and ask a couple of questions for each of you to respond. And I'm going to put the question in the chat. So, okay, I give you only one question this time. This question is about your mindset, or even you can describe your feeling as well. So what is one word or one phrase that best describes your current mindset or feeling in terms of the question of what's on your mind? So please. Oh, first one get overwhelmed, okay. Determined, yes. Ready to transfer, yes. Determined, focused. Okay, good. Focused. Determined, focused. Okay, fresh start. Excited. Optimistic, yes, I like that. Nervous. Ready to finish. Excited. Nervous, yes. Yeah, you'll be fine. Okay, so you can still keep typing. So thank you. And now speaking about our Department of Public Health and Recreation, we are very proud that our programs are legacy of impressive rich history of producing large number of passionate and talented alumni who make a difference and have a meaningful impact on the people and the community that we work with as a transformative leaders within the public health and recreation workforce. Indeed, the leadership and success stories of our alumni are a testimony for our high quality, relevant, and rigorous programs in our PHL department. So in terms of history, last year we celebrated 50th anniversary of our MPH, Master of Public Health Program, whereas next year we are going to celebrate 75th anniversary of our recreation program. So in addition, our undergraduate public health program, which you have been admitted into, has grown to become one of the largest and most popular programs on campus, which makes the total student population of over 1,300 students at both undergraduate and graduate levels combined. So to build on the legacy and impressive milestones, I'd like to pinpoint the core foundation that reflect the mission of our department, that highlight our commitments to 3 areas of focus. That is our fierce commitments to number 1, student success, number 2, engagement, and number 3, impacts. But the question is, what do we mean by each of those words? So let's look at each word one by one. The first is student success. Then I would like to ask another question for you, that is, what do you mean by success from your perspectives as a student, new student at San Jose State University in the Department of Public Health and Recreation? So please type and share your answer in the chat box. So that again, the question is, what do you mean by success from a perspective of new incoming transfer students into our program of public health recreation at SSU? And what the indicators of success from a perspective. So I would appreciate it if you could type and share your insight in the chat, please. Having a career that truly I love. So again, the question is, okay, what do you mean by success from your perspective as a new student into a program? Okay, staying motivated even though our current hardship. Okay, helping and engaging communities. Yes, finishing. Yeah, I echo your ideas. So it's important for you to successfully complete your degree. Yes, a lot of great ideas came out. Thank you so much. Yeah, you can still typing, but I would like to tell you that we as a Department of Public Health and Recreation value proactive outreach and a connection with all of our students to provide holistic wrap-around student support and guided pathways approach to meet the student at where they are by being compassionate, caring, and empathetic about whole sorts of complex challenges our students are facing, including meeting basic human needs. Through listening to the voice of our students and empowering and lifting the students up. So let's move on. And the next word is engagement. And the question is, what do we mean by engagement? Including the question of engagement with whom and engagement is what? And what triggers the mind when you think of engagement? And to what extent do you feel that you are engaged with their life? So again, I would appreciate it if you could share your insight about engagement from your perspective in the chat box, please. So again, key question is what trigger your mind when you think of engagement, including the question of engagement with whom and engagement is what? Yeah, so in terms of a question of engagement with whom and engagement with what, we are talking about engagement of our students, of course, students and alumni, and engagement of our faculty and staff, and engagement of our community and industry partners as an alliance to maintain the strong pipelines between the education system and the workforce. And thank you so much for sharing your ideas about engagement. So indeed, I'm very pleased and proud to let you know that our department is fully committed to serving and meeting our students at where they are based on a robust caring infrastructure supports to ensure the success of each and every student. So for this purpose, we provide high impact student-centered curricula, advising and mentoring, including worksite internships, project-based learning, applied research, and community service learning, as well as opportunity for your professional development and career explorations and advancement. So at the same time, we acknowledge that one size doesn't fit all. Therefore, we offer personally tailored and customized student learning, advising, and mentoring, and wrap around the student services through a partnership with student success centers and the career center at San Jose State, and the counseling and psychological services and the other unit across the campus. So its purpose is to build a robust and caring community of learning where all students feel valued, cared, supported using a guided pathways approach. So let's move on to the last word, which is the impact. We can define impact in a number of different ways, but for now, let's think about impact on whom and impact on what, as well as the impact of, as well as indicators of impact. So what do you think? So please, again, share your insight about what you mean by impact, including some examples about indicators of impacts in the chat box. Yes, provide support for needs for those in need. Yes. Making others feel heard and cared for. Well, thank you for your insight. Impact on the individual community. Yes. So there are different dimensions in terms of the impact on people and the social area and also societal structural areas. And being able to see the change and the benefit you're providing for the community. So so we have a couple of concentrations. One is population data science, and the other area is community health education. And our faculty advisor is going to give you a lot of details about these two concentrations. So speaking of impact, we are concerned with outcomes and also results from our actions. So for us, one of the most important indicators of impact is retention in terms of the progression and the persistence of our students toward completing their degrees, which are pathways, the pathways and pipelines toward good jobs and employment, which are also important indicators for social economic mobility, and return on investment to clearly demonstrate tangible and concrete positive outcomes and results from the completion of degrees. Because you invest your time, money, and energy into completion of degrees. So overall, we as a San Jose State University all committed to serving the public good because we are a public higher education institution, which is a part of the entire education ecosystem from infancy development and the early childhood education all the way through adult learning from an intergenerational lifelong learning perspective. Then the question is, what is the public good? So can you share some example of the public good? So again, please share your answers in a question of what the examples. So I would like to hear from you in terms of example of the public good. Okay, helping at the local food bank. Yes. So as I mentioned earlier, so we recognize that a lot of students, and including also faculty, trying to deal with some of the meeting the basic human needs. That include, of course, food security and housing security and access to internet and so on. Volunteering. So a lot of ideas about volunteering came out. Volunteering at homeless shelter and hospitals, educates the community, helping local minority communities, volunteering at youth programs. So I was born in Japan, and I used to work in Canada, and healthcare is national responsibility. I mean, so we got a national healthcare service. And so health is clearly a public good, and education is a public good, and also human services are public good. So if we look at the composition of our college of health and human sciences, so we have a program called social work, and of course, public health, and kinesiology, and other programs which are mostly part of consideration of health and human services areas. So another key point about impact making and serving the public good involves social change and transformation, because it is our responsibility for all of us as citizens of this country to contribute to making our society a better place to live for all people, regardless of differences, for the betterment of humanity and inclusive excellence. So for this purpose, it is extremely important for all of us to pay attention to and show our commitments to DEI. So this is my last question for all of you as a new transfer students. Do you know what DEI stands for? So please type and share your answer in the chat. The question is, what does DEI stands for? Yeah, my guess is that many of you have heard this expression before from different sources of media. So question is, what does DEI stand for? Yes, catering, you get the right answer. Diversity, equity, and inclusion, yes. Again, the following question is, so what do you mean by diversity, equity, and inclusion? So you can come up with a different definition, but succinctly speaking, diversity is about representation, equity is about fairness, and inclusion is about belonging. So therefore, DEI stands for diversity, equity, and inclusion. That represents a constellation of representation, fairness, and belonging. But what do you think about that? So do you think that DEI is something that we are all concerned with? What do you think about your role in the DEI movement, which is literally happening every day in our life? So my point here is that as a public higher education institution, our university is fully committed to advancing the DEI movement, because the purpose and the mission of the university is to serve the public good and enhance inclusive excellence and the betterment of humanity. So therefore, our commitments to DEI and social justice is a collective responsibility, and each and every one of us has a role to play to dive in and fight for change, to truly embrace and foster collective humanity and inclusive excellence. So to end my remarks, key takeaway from my welcome message as a department chair this afternoon is that our faculty and staff in our department all care about, fully committed to student success, engagement, and impact that we briefly looked at as a core foundation of our PHL department. So despite the large size of the department, we value and embrace the importance of personal touch and personal outreach using personally tailored student advising and mentoring and wraparound student services, as well as providing high quality, high impact, emancipatory learning opportunity for all of you. So ultimately, our purpose and the commitment is to build a strong sense of identity, connection, and belonging within a community of learning where all students feel welcomed, valued, cared, and supported. So finally, I would like to let you know that the door to my office is always open, anytime, anywhere. Even though we are currently working remotely, but we are planning to go back to campus from next semester. So please feel free to reach out to me through emails, phone calls, or you are welcome to come to visit my office at the Spartan Complex building on campus. So once again, congratulations and welcome to the Department of Public Health Recreation at SSU. And I'm turning back to Felicia this time.
Thank you, Dr. Iwasaki. And yes, we hope to see you on campus in fall. I think they said July that we're supposed to be back on campus. All right, everyone. So like the video said, at San Jose State, you're going to have two advisors. You have us, the GE advisors, and the College of Health and Human Sciences Student Success Center. And as a public health major, you actually have a bonus. You have major advisors who are experts in your fields, and you also have peer advisors who are also public health majors, such as yourself. Today, I have the honor to introduce Dr. Marcelle Dougan and my office neighbor, Felicia Noonis, who are not only major advisors, but will be instructors in your class eventually. And our public health peer advisor, one of them is Kim Nguyen, who's actually here as well. How are all of you doing? Miss you all.
So nice to see your face. We also have Nancy Ortiz and Vanessa Reeves here as our peer advisors. And
Hi, Nancy. All right, let me know if you need me.
all right, thanks, Talisha.
Okay, thank you, Talisha. Hello, everyone. My name is Dr. Dougan. I am the program coordinator of the Public Health and Recreation of the Undergraduate Public Health program. Welcome, welcome, welcome. I'm so excited to see all of you here. You have picked the best major you could ever possibly pick. So just welcome and congratulations on your acceptance. Felicia.
And I'm Felicia Noonis. You've met our spirit soul woman, Dr. Dougan. So her enthusiasm for this program is infectious, and I hope you're feeling it even through our online format here today. My name is Felicia Noonis. I am a faculty member here at San Jose State in our public health program, and I'm also the advising coordinator. And I'm just getting butterflies in my stomachs, I don't have 8 like a cow, I've got 1. Butterflies in my stomach, thinking about being in your position right now and the excitement around what's to come. And so I look forward to talking with you today. Kim, did you want to introduce yourself?
Hello, I am a public health peer advisor, so I'm a student. Well, you guys are probably students, so I'm like you guys. We're just here as peer advisors to give you support about what classes to take and everything. I'm really excited to see everyone. I'm looking forward to talk to you guys in the breakout rooms or advising later.
Okay, thank you so much, Kim. Just a few reminders before we begin. Once you're done, be sure to return to the main room. You can click, there'll be a button on the bottom right of your screen to leave the room, and then click on leave the breakout room. Don't leave the session. So leave the breakout room so you can be returned back into the main session where you'll be asked to complete a survey. And if you don't complete the survey, you'll be marked as absent, and you could possibly lose your status as a matriculated student. So definitely make sure you go back to the main room so that you can complete the survey at the end of today.
Marcelle, we have two more PHPAs.
Oh, I'm sorry. Okay. Sorry about that.
Nancy and then Vanessa, if you could introduce yourself.
Okay.
Nancy, you're off mute.
Sorry. So I was saying I'm glad that I'm here doing PHP 8 today for you guys, because I was a transfer student too, and I know how overwhelming it can be, and you guys must be really nervous, but it's gonna be fine. SJSU is great, and you have a great major. Thank you.
Hello everyone, I'm Vanessa. Unfortunately, I can't turn on my video, but I'm excited to help you all today and, just get y'all acclimated with the public health major, even though we're online. Just like Nancy said, y'all chose a great major, a lot of great professors and advisors. Thank you.
Okay, excellent. Thank you. Thank you all. So for today, we just have a short, well, it's not that short, but we have a quick icebreaker to get to know you a little bit better. And then we'll tell you all about our program. We'll take you through the couple of main websites that we have for additional information. and then give you some advice. You'll hear from the public health peer advisors, PHPAs, on how to make the most of your time here. And then we have a little bit of time saved at the end for some advising. So for the icebreaker, if you could please go to menti.com and enter the code 7890749. Alternatively, you can just scan the QR code if you have a smartphone. Okay, again, the code is 7890749, and it's on www.menti.com. Okay. All right, Felicia.
All right. So let me see. I logged in. Let's see, it's working. All right, mine's working. So Dr. Iwasaki got into the deep diversity, equity, inclusion, and we are going to ask you things like, where are you? We want to feel grounded and connected to you. So where are you coming from today? Where are you signing in from? I am in San Jose, about 2.5 miles from campus. Alameda, one of my favorite places in California. I lived there for 5 years. I would go live back there if I could afford it. Castro Valley, Salinas, Castroville, Santa Clara, Redwood City. Looks like so far Sacramento might be the furthest away. All right. Is that capturing everyone? Most of us in San Jose, but lots of us in other parts of California. Fabulous. Let's see what the next question is. We want to check in where you're at. So on a scale of 1 to 7, 1 being sad, depressed, and down, 4 neutral, and 7 being awesome, happy, and elated, where are you today? What's your mood in this moment? I get really excited by these things, so I'm pretty much a 7 right now. How about you, Marcelle?
Yeah, I'm a 7. I'm a 7. The sun is shining. We're winding down with a semester. I'm not thinking about grading, so that's why I'm a 7. But I'm a 7. I'm happy to be here. This is one of the highlights of my job, this transfer orientation. It's a lot of fun, so very happy to be here.
Kim, Vanessa, Nancy, where are you all falling on this schedule today? On this?
I would have to say, oh, sorry. I would have to say 7. Feeling pretty good about finals and just finishing the semester. So yeah, I would say 7.
I think I was a 5 before I got here, and I'm a 7.
Oh, that's great. All right, so most of us are feeling on the positive side of things. And for those of you that aren't, if there's anything we can do to support you, if there's some piece of information that will help you alleviate some of the worries or concerns you have, please let us know in chat or aloud, in whatever ways make you feel safest. All right.
Okay. And if you're feeling overwhelmed, don't try to remember all of this. Just take good notes and you will learn it as you go along. Yeah, just take good notes and take the pressure off. We're here to support you.
Good advice. And you've got lots of us to support you, right? So you now know 2 faculty members. We're the best faculty members. So I mean, you've got, you're so lucky. And then you've got 3 peer advisors. So they're wonderful. All right, they're the best peer advisors too. So which superpower would you like to have today? Teleportation is top of my list. Mind reading, flying. If for those of you that are saying, I already have one, if you could put those in the chat box so we can get to know what your superpowers are, that would be fantastic. If anyone wants to share why they chose their particular superpower, why you'd like mind reading, flying, teleportation.
I'll share mine. I would say flying because I hate driving.
Mine is flying too, Nancy. Danielle, chronically late.
You can teleport just in that moment, right? Convenient, no traffic and teleportation, says Talisha, who lives 2 hours from campus. No traffic. Yeah. Oh, one person chose invisibility. Those of you that chose mind reading, why? What do you want? What do you like about that? So I know what my patients are thinking or feeling. Thanks, Catalina. All right. Okay, what's next up? What is a saying or expression that you probably say too much? I don't say this, but people around me say it too often. 100%. 100%. Yeah, 100%. 100%. I'm like, oh my gosh. Let's expand our vocabulary. That's crazy. I'm hungry. Bet. Bruh. It is what it is. Oh my God. Sheesh. Hella. Oh, I love hella. Yes. Hella. I'll do this assignment later. Sheesh. Nice. Hella. Hella, hella, hella. When I moved to school at San Diego State, and that was where I got my undergraduate degree. And in the first week of classes, like after orientation, when school started, everyone would go, oh, you're from Northern California. And I'm like, well, how do you know that? Like, I don't have anything written on me or that. Oh, you say hella. Like, we don't really say that down here. And so it's spread. It's more widespread, but yeah, hella. That's tough. Oh, shoot, I'm sick. Yee. Nice. We'll cross that bridge.
Hella is a popular one today. Yeah.
Yeah. Oh, shoot. Who dat? It is what it is, but c'est la vie. Okie dokie.
Artichoke.
What do you want? Marcelle, I think you can adopt that one. Okie dokie. All right. Fabulous.
Yeah.
Thank you. Oh, the PJ question made it in. So hand on your heart, are you in your PJs right now? 100% yes. Never. Business on top, PJs on bottom. I literally took them off just in time for the meeting. Today I am no, I try not to come down my stairs without getting dressed. Otherwise the whole day turns into something. All right, a good mix of people. I'm glad you're comfy. Take advantage of these online moments while we can, now that we see that they might go away a bit. Fun. Thanks. So this taps into what Dr. Iwasaki was saying earlier, but if you can kind of distill down some of your thoughts when you think about what you're going to learn in public health. So put 3 words or a phrase that describes what you think you will learn in this major. Understanding that you have not taken a lot of classes in public health. So lifelong hobbies that I will love. You might want to do a minor in recreation. If you're thinking about hobbies, our fellow department, our program in our department, recreation would be a great minor. Epi and COVID. Oh, we'll talk COVID. Decades to come. To manage my time better, respect for newfound communities, research, diseases, communication, compassion, community, and wellness, more passion, empathy. I just had a student say to me, he couldn't tell me who it was from, but he said passion. I didn't know what it was, and a faculty member said, passion is, you get excited to do it when you get up in the morning. You don't need to rush to stop doing it in the evening. And I was like, oh, okay, I can see that. And it feels like time flies when you're doing it. How to better the health of the community, public outreach, education, helping others to help themselves, manage care, compassion, community health, better communication, understanding, community appreciation. Nice, lovely. Yeah, I agree, Nancy. I hope that is true. Learn to love the major. Hope that comes to you all. Vaccines, there they are. Vaccines, positive changes in the community. In all the years we've been doing this, vaccines never came up before COVID.
Because we take it for granted. We were taking them for granted back then. Yeah.
Yeah. What words or phrases come to you, Marcelle?
Me, I think passion, community. I would say also togetherness in terms of public health. Yeah.
Thanks. Raymond, got your preventive medicine? Prevention, absolutely. Women in healthcare? Fabulous. So many things that you will learn. And I love this piece that so many of you are sharing about community, right? And community wellness and appreciation and understanding the assets that every community has, and having that mindset going into public health is going to be such a gift. Thank you. All right, so now we want to know where you're going. Are you doing public health with a minor, or are you doing one of our concentrations, community health education or population data science? There you go, Marcelle. There's your PDS, folks. You're going to do a minor as a pathway, community health or population data science, or are you not quite sure in this moment if where you're at is the right fit? That's okay too. All right, Raymond's doing community health. There's still about 8 or 9 of you. Are you not signed into the Menti? I'd love to know where you are. Okay. These always remind me of Mickey Mouse ears for some reason. All right, so we've got a good mix of folks here today. We've got a little something for everyone today.
Okay.
All right, I'm turning it over to Dr. Dougan.
Okay.
I was ready. I'll turn it over to myself. Hold on.
Oh, you want to take? Okay, go. Let me just stop. Yeah.
All right, there you
go. Okay, so I just wanted to take a few minutes to go through our program learning outcomes. You might hear them being referred to as PLOs as well. We have 8 of them in the undergraduate program in public health, and basically every single course you take has its course learning outcomes, which are CLOs, and they all align to one or more of these program learning outcomes. So this is what we hope for you to have gained by the time you leave this program, by the time you walk across the stage to pick up your diploma, which I think is usually the highlight of my year. So watching you all graduate and walk away from here as a faculty member, nothing gives me more pleasure than that. And this is what we hope that you walk on that stage with, having learned and appreciated in our program. So 8 of them. First one says, apply the principles of social justice through the lens of cultural humility to achieve and sustain equity, right? So many of you talked about your passion and your interest in developing a sense of community and working with a community. And so thinking about, if there's one thing the coronavirus pandemic brought to light, is how uneven our population is, right? Some people were more likely to get sick and die from the virus than others. And so understanding this and being able to make to develop interventions that help us sustain equity, because these inequities are unfair, right? And we have no use for them in society. So the goal is to achieve health equity. The second one, this is one of my favorite ones because it talks about how public health is everything, right? So you will be able to explain the intersectionality of environmental, social, economic, behavioral, biological, and political factors influencing human health. So all of these pieces interact together to influence human health, right? And your goal is not only to understand how they all interact with each other, but also be able to identify opportunities for change, because that is where change happens. Another one, interpret and apply ethical principles to the practice of public health. When you go into your careers after you leave us, you might be faced with many ethical dilemmas. And so we are going to provide you with the tools and scenarios for you to be able to overcome those and continue to practice the highest standards of public health, which is to focus on the good of the community. Next one is demonstrate an ability to deliver public health messages in written, oral, and media-based formats to both public and professional audiences. This is one of the critical pieces in public health and in what we do, because it's great that we have all this knowledge, but we need to be able to translate it in an accessible way, not only to colleagues that speak our public health language, but also to the general public. I am sure you're thinking about, again, the current pandemic that we're living through. So many sources of confusion. Do we wear masks? Do we not wear masks? Can I get vaccinated? Must I not get vaccinated? How are we going to be able to deliver coherent messages so that to limit misunderstanding and worse, to limit when people follow our messages, then something that we did not intend happen. So you will learn how to do this. A lot of we have a number of different classes where all of these pieces will fit in. A number of our faculty are looking at different ways of communicating, including podcasts. So you will have the benefit of learning how to do that as well. All right, so this one near and dear to my heart is the idea of collecting and analyzing public health data, right? So we have a lot of data and we want to be able to make sense of it. So we want to know who gets sick, where do they get sick, when, are there trends that we can see across time? Are there certain clusters where we can see where more people are more likely to get sick than others? So all of this you can do with analyzing data. And we have a number of courses in the core curriculum. And then if you go into the population data science concentration as well, there are many, many opportunities to collect and analyze data. Number 6, this talks about the past and the present and the future, right? So you want to be able to interpret the basic concepts of human health and disease and research grounded in history. So because we want to understand what the historical perspectives are so that we can learn from them and avoid some of the more egregious things that have happened. And so looking at that, then just focusing on the history and then also how that relates to the philosophy of public health and also the practice as well, which governs what we do and how we show up as public health professionals in the world. Number 7, important one. You'll hear me say this about all the PLOs, I think, because they're all important. I can't necessarily pick one, but this is a big one. Thinking about the effects of multiple levels of policy and health systems on population and individual health outcomes, right? So you want to be able to analyze the effects and also employ strategies to participate in the policy practice. In public health, we do a lot of great research, we do a lot of community outreach, but none of these can be affected without solid policy, right? And being able to engage in the policy process. So there's one public health policy class where you'll learn a lot about that, but interspersed in all of your other courses, you'll learn a little bit about this, because it's very, very important, because this is where the change happens, right? You know, we can talk about things like, we understand that, you know, Black women are more likely to die from childbirth than any other race in the US. But how do we create policies that then save the lives of women? And we can understand the problem, but if we don't have the policies in place, there is not a lot we can do, right? With the coronavirus pandemic, we know that Blacks and Latinos were more likely to die from it than any other race. And so what kinds of policies are we going to enact to reduce those deaths, okay? So definitely so important that some of you enjoy and participate in the policy, in developing policies. And then the last one is, it's kind of a catch-all, right? And many of you alluded to this, you know, when you were talking about some of the things that you can learn, that you hope to learn in this program. So we want you to be able to use public health processes and practices, including working collaboratively with diverse individuals and communities to create relevant interventions and investigations. And I can't stress this part enough, being able to collaborate. Public health is not a one-person show, right? And so you want to be able to work with people who look different from you, who think differently from you, who act differently from you, because that is the only way we can all work together to make the magic happen, right? We can't just do it on our own. We can't just like swoop into a community and then just give them directives and then leave, right? We want to be able to work together collaboratively, creating relevant interventions. Again, you want to be able to create an intervention that is relevant for that community, building upon the assets that already exist, as Professor Noonis was talking about earlier as well, right? So we can't just assume that we know best as public health professionals, but we can use our knowledge to effectively engage in an open-minded way and an open-hearted way as well. Most importantly, we want to engage, as I mentioned, and build community capacity, because we want to leave communities, because communities want to be able to develop on their own, right? And so we want them to be able to do that, to be able to create sustainable change that would enhance their lives for the years to come. So build capacity, promote health, and most importantly, we want to be able to reduce health inequities and disparities, because these disparities, they're really unfair, they're really unnecessary, and they can be avoided. So definitely, we want you all to work together once you go out, during your time here, and once you go out, to be able to make all of this happen. Okay, I will now turn it back over to Felicia, who will talk us through the program.
All right, so let me say this first. We're giving you this big overview, but we want you to leave here today knowing which classes you're going to register for. So this is all building up to that. So Dr. Dougan gave us that overview. You're going to learn a lot in your 2 years or 3 years or whatever it takes you to get through. It took me 7 years to get my bachelor's degree. 4 years after I transferred, I got it. So this is our program. Our program has undergone some changes, and they began in fall of 2020. So you are coming in 1 year into our new curriculum, where we are seeing many courses being phased out and others being phased in, which is really exciting. So on the left, we have the things that it is most likely that you came in with, right? So all of those lower division GE requirements, the American institutions, the PE, all of those things that you've come in with. If you have not, and then we have our prep for the major. So students who were brand new students, first time Frosh in fall 2020 and later, they have to take these 3 science courses. You have been in school since spring 2020 or earlier, and you are not required to take these 3 science classes, though many of you have, and they're recommended. They are required in our new curriculum for our first time Frosh in fall of 2020. But these 4 classes down here, these preparatory classes, it is expected that you are coming in with them, or that you will complete them the first semester that you are here. So PH1 or its equivalent, which is a personal health class and understanding your health class, PH15, which is human lifespan, 67, which is our intro to health statistics class. And so it might have come over for you as a Stat 95 articulation, that works. And then lastly, our intro to public health. We started teaching this class in fall of 2020. I'm actually one of the faculty members on it, and have been working to help create it on the team. And I'm so excited this coming semester, I get to teach a section of Intro to Public Health in person. And so we have one section of Intro to Public Health that will be in person next semester, Mondays and Wednesdays at 10:30 as a plug. So if you're ready to come back and you want to do that, that would be a great class. Some of you have already come in with your Intro to Public Health class too, and that's great as well. Okay, our major falls under the College of Health and Human Sciences, as you know. And a part of that is an international experience requirement, which is also, it began in fall of 2018. And there are many ways to meet that requirement. And I think they talked to you about that, but the counselors, the advisors in the Success Center are the ones that you can speak with about the international experience. So the middle of this is our requirements of the major, or our core courses, as they are called. These are classes that all of our public health students will take. You'll see at the top of the list, health team building. As Dr. Dougan said on that last program learning outcome, you often do not work alone in public health, and you are going to be given so many opportunities to work on teams. And if you feel like you haven't met anyone during the pandemic, hopefully that will change in fall of 21 with your classmates. And so we start off there with health team building, which is a class that all of you should likely be in this coming semester. So first semester in, transfer students, Public Health 102, health team building. And then we've got a variety of classes. You see policy and community health and health issues in a multicultural society, health communication, EPI, which I know a couple of you were really excited about, healthcare organization and administration, which others of you are about. Those classes, 3 units except for community health, which has 1 unit of service learning, and that's what the SL is. So then we have this new series that is a part of our program that I am just so excited about, and we've been getting rave reviews from students about how it's being taught, and that is our leadership series. Our leadership series is a series of 4 courses that are meant to be taken one after the other in your last 4 semesters. So if you are taking 15 units a semester, it is likely that you are going to finish in 4 semesters. If that is you, you will enroll in 165A, the first leadership series class for this fall, 2021. Notice the leadership series classes are not 3 units. In fact, most 3 of the 4, oops, that's supposed to say, oops, got to move that. So the leadership series 1, 2, and 3 are each 1 unit, and the fieldwork experience is 2 units. So everyone now within the major has to do a fieldwork experience, an internship of 120 hours. And that is because that is where you get to apply what you are learning. You make connections and often find jobs. In fact, my very first job out of my undergrad public health degree was because of an internship I did in my program. So we've got that leadership series, and the leadership series 2 sets you up. So each one sets you up for the next one. So that's why they're supposed to be taken in sequence. We've got our biostats class, which is a prerequisite along with EPI for our population data science students. All right, then we have an environmental health class, which is also an SJSU Studies Area R class. And our new courses as a part of the core are population health electives. So community health or global health. So that's what everyone's going to do. Then on the right, you see the 3 different pathways. And so if you're choosing a minor, you can choose any minor at this university except for health professions. So every minor at the university fits well with public health. I have students from all, walks of interests. So I've had economics and child and adolescent development and nutrition and psychology and human rights and Chicanic studies. So find something that appeals to you, find something that you have interest in, that you want to know more about. And so for some of you, you're going to pick the minor route, right? So you choose a minor. Minors are anywhere from 12 to 23 units. Most of them are 15 to 18. And so you'll do that. And then you'll do a capstone course. So one of the new pieces of our curriculum is every pathway has a capstone that puts to practice and applies all that you've learned in all of these core and preparatory classes. So if you're doing a minor, your capstone course is 179, program planning. If you're doing population data science, you will see there are 6 classes. Both of the concentrations are 18 units. And you see the different classes that are available within them. And you also see these capstones. The concentration classes have been created to fit in your last 2 semesters. So as a senior. And so we'll learn more of that as we go along. So each concentration and the general pathway has its own capstone course. And for your internships, if you are doing community health education, population data science, your internship will be geared towards that. It will be in places where you get to apply that education and that expertise. And if you have a minor, maybe you'll find an internship that has to do with children and public health, if that is your interest. So those are the 3 different pathways to degree in our public health program today. Notes on the new curriculum. So as I said, you don't have to take the science courses, but many of you have taken some of those courses, which is going to serve you well. So we do recommend a minor. Talisha put in the chat box the full list and just go through it. Spend a few minutes scanning through the names, clicking on it in the catalog and seeing what courses are required and see what appeals to you. Maybe you took a class as a part of your lower division GE that you really enjoyed. Maybe it was a nutrition class. Take a look. Maybe it was justice studies. See what those requirements are. As I said, your concentration classes are taken in the last 2 semesters. And so one of the pathways that we are teaching out is this option down here of 21 units of upper division electives. So if you have been continuously enrolled at a community college prior to fall of 20, which means that you can take a semester off, but not 2, you have the option of this 21 units of upper division electives. It's the most flexible. For those of you who are interested in pre-something, pre-med, pre-dentistry, pre-nursing, you might want the 21 units of upper division electives because we can use some of your science classes there. But for most of you, choosing a minor or a concentration is really going to be your best fit. For instance, if you're interested in health services administration, there's a business minor that really prepares you for that type of work. All right, Marcelle. Oh, I can't hear you.
Yes, okay, thank you. I'm going to take you on a gander through our website. So let's see, let me just share my screen for a minute here. So the best way to get to our program website is sjsu.edu/HSR. So our old name used to be Health, Science, and Recreation. So that's where the HSR comes from. Okay, thank you, Felicia. And then, so once you go in there, so it will now say Public Health and Recreation. So that's how you know you're in the right place. But the best way to get to our undergraduate program is here, Undergraduate Public Health Program. And then you have all the information for continuing students or new students. And then we have a new probation policy that went into effect last fall. So definitely make sure that you read it and you familiarize yourself with it. And then here on the side, we have some links. If you want to know more about advising, if you want to book an appointment with an advisor, you can go here. And then there's an option to get faculty advising or drop-in advising. We do have some tutorials that could help you fill this out if needed. The substitution form is sort of out of we don't use those anymore, but these need to be updated. But if you want to make an appointment with a faculty advisor, there's some information here. One, you can email, and then we also have Start and Connect as well, which is where once you have access, you will be able to book an appointment with an advisor. Our peer advisors, you can contact them here as well. There's an email address and they can give you really good advice. They have been in the trenches. They have been through where you are now, where you are going now. So they're usually a great resource as well. Another place is here, forms, and you can find all the forms there that you need. So you would be looking at under N for new, that if you're starting in the program, there's some information here for there's one for transfers as well.
The forms
yes.
transition, the forms under transition, under the
Okay.
letter P, those are for
Yes, these are for transfers. Yes. Okay. Yeah. Thank you, Felicia. And so you can get all that information. But again, you don't have to remember all of this. Just know it's there for you. And there's some information as well for new students. Some here for incoming transfer. So take a look, and you can get some overview information as well. Again, you don't have to remember, just take the notes so you can find out what's where and what's what. So that's just a quick overview of our website. Go there, play around, because that's a great resource for you to find out some information. Now I'll turn over to Felicia again, who will guide us through the blog.
All right, so we also have an advising blog where I've just put it in the chat. Oh, somebody already beat me to it. All right, thanks, Talisha. So our blog, this is where we try to put the updates on things, especially around registration, different events happening. And so you'll see there's all of these things up at the top, but I'll start here in the feed. So today we had a open house for students who are interested in public health. So that was posted here. And then little things like how do you request an ad code this semester? So we've got that on there. Were you having trouble with your classes? Updates. So these are all really great places to go if you're thinking about, oh, I wonder if this thing has been updated. So that's an excellent place. And then up here, the other place I wanted to show you was general FAQs, and there's a transfer student FAQ there. And this leads you to what classes should I take? So these are the things we're going to talk about today. They're also on our website, as Dr. Dougan pointed out, but this is another place to look at, okay, how do I decide about a major, what student groups, all the good stuff we're going over today. That was under general FAQs and transfer student FAQs. So you'll see some other things on here, links to our public health peer advisors, internship opportunities, different things as we go through. I think since we are sitting here for a moment, so we'll go back to the forms when we get to the next section. All right. Okay. So those were our websites and where you can go to find some information.
Okay.
And Marcelle, was I turning back over to you for this one?
Me?
I don't
So
know.
I can go.
I can.
Yeah. So just some tips for you when you well, you don't want to do that mid-February, but because that has passed. But you want to make an appointment with an advisor as soon as possible. Okay, so we suggest probably September, through October while you come, just to make sure that you're on the right track. Please make sure you are using and checking your SJSU email. That was already mentioned earlier in the earlier session as well. So you want to do that, or you are having your email forwarded, because you don't want to miss important announcements. There might be deadlines, there might be other important information, something that you need to do. So be sure to be checking it regularly. One thing I will say is that always attend class, even if it looks like you can get by without it. Sometimes you might think of classes particularly easy, you will just get by. You could miss some important announcements and your colleagues might not remember to tell you even. So you want to be sure that you're there and you're always present. If you're not going to be there, then you definitely want to let your instructors know ahead of time, especially if there might be some quiz or anything that you could miss if the instructor doesn't know. So you want to be sure to do that. One thing is, you know, the road is never easy, and we understand that you are your whole self, right? It's not just how you present in class, it's just everything that you bring to you, with you. And we welcome that and support that. So if you are struggling, you want to seek help from your professors and advisors with anything, whether it's school related or whether it's not. We understand that you are whole, right? You are more than what you're more than what, you know, your spot in the class. So you want to let them know as soon as possible. I know sometimes as human beings, when we're struggling, we want to retreat, right, and shut down. But you want to push to let somebody know, because that way we can help you, or we can definitely find somebody that can help you, that can give you additional support. So please, please, please let us know. Things come up all the time, things that we didn't foresee, things that we could have avoided. Whatever it is, we don't care. We just want you to know that we're here to support you. Okay. So I'll turn it over. Oh, yes. So coming in, then you will be partnered with a peer advisor. And you will be notified via email within the first 2 weeks of class. While you are here, there's nothing like practical experience. So you want to be able to look for opportunities to apply your knowledge. And you can do this in a variety of ways. You know, look for internships that are in an area that interests you, or you can do research with professors. That's also a great way to apply what you're learning about in class. So for example, if you're doing epidemiology and you're working and learning about study design, you can work with a professor who is actually doing that study design, and then you can remember more. So definitely look for those opportunities as well. Sometimes they're advertised. Sometimes you just have to reach out to a professor, and they always have many interesting projects that you can work on. Also, try to look for other related work experience as well, and you can find some really well-paying ones to support what you're learning in class. There are other resources available to you. Faculty usually have office hours, 1 to 2 hours every week. There's a great place to go and meet with your professors. And it's good to get to know your professors while you're in class. You will need letters of recommendation one day for a job or for applying to graduate school or for anything else. So you want to get to know the professors as best you can. So definitely you want to go to office hours. Our peer advisors who are outstanding, and they can tell you a little bit more about their experience, are here as well to help you through the process. Like I said, they have been in the trenches, so they really know what it's like. Like, we teach the classes but we have no idea what it's like to take the classes. So you want to talk to your peer advisors for that. And then we also have peer tutors as well, who can support you if you're struggling with some of the classes that sometimes students find more challenging, like, perhaps the math classes, epi, biostats. We have peer tutors through the tutoring center that could help you with some of that as well. And like I said, our one goal is to make sure that you're successful. So we all of us want you to be successful. And so please make use of all the resources that are available to you. All right. Felicia, you want to take this?
I just want to say we only have 15 more minutes. So I wanted to get to the advising piece.
Okay.
But let's do a quick check-in. So who was the PHPAs, did you want to do a quick moment on the different student orgs?
I can speak briefly on PHPA. So hi again, I'm a public health care advisor. We are a source student-ran organization of public health advisors, public health students from various minors and concentrations. We have advising hours throughout the week, and we can hold one-on-one meeting advising sessions with you, the students, to help choose classes, what classes to choose. Maybe if you're struggling with classes, we can give you that personal insight because we've been there, and we're available throughout the whole semester. Yeah, and we're here today to help you guys as well. I believe you'll also be paired with one of us one-on-one, so we'll be reaching out over email as well to connect with you guys.
We've got, lots of ways to get involved. And so we have an honor society and a student association that is open to all public health students. So lots of ways for you to get involved and to get connected. PHPAs, did you want to give a couple of quick tips from your experience as online experts at San Jose State now?
Yeah, I can go ahead and speak on that. Obviously, just with the transition of online, I feel like your best tool is going to just be time management, and really like utilizing like Google Calendar, or like if you may like using like physical notes, like a actual planner, really plan out your day and plan like the things you got to do, like classes you have to take, homework you have to do. That's a tip I found to be like most beneficial to me as far as like being successful in the online environment. I could go ahead and let Kim or Nancy talk on any other tips they would like to share.
Hi, this is Nancy. So just I wanted to highlight something. If you guys are doing mainly online, just know that online is not that bad. Like, I remember when I was a transfer student, just like trying to find like an advisor in campus was overwhelming because campus was so big. I feel like online it has been a little easier to like get a hold of people. And then when it comes to public health peer advising, I would say definitely take advantage of it, because if we don't know something, we will find out for you from an advisor, you know? So I would definitely take advantage of that. Thank you.
And also just some, oh, sorry,
Nope.
Felicia, did you have? Oh, just going off of like the slide as well, you know, stay connected in class. So like means being engaged and keeping your camera on, you know, it really sets you or puts you apart from like other students in your class who may not have their camera on. Then also I've just heard from a lot of my professors that they enjoy when students have their cameras on, because, you know, they're not just talking to a blank screen. Sometimes it makes them feel like no one's even there. So yeah, so just stay connected in class and be engaged. And then also attend office hours. So if you're struggling with any material in the class, or even if you want to get to know and connect with your professor, that's another like thing you could do within office hours. So it's not only just asking like for help on any material. And then lastly, make an appointment to see an advisor via Spartan Connect. So right here is the website that y'all will go to in order to request that appointment. But yeah, I'll hand it over to Felicia or Dr. Dougan.
Thank you all. All right. So advising time. If you have at least 60 units, you are going to want to make sure you've completed all of your lower division requirements, right? And they talked about the GE, your American institutions, your PE classes, your public health prep classes. If you have not finished some of those, that should be done in your first semester, so fall 2021. If you have at least 60 units, that means you will have upper division standing, and you can get into our public health core courses, those classes that were in the middle in the yellow on that graphic earlier. You can also register for, if you are going to declare a minor as you search through and figure that out, you can take lower division and upper division courses within the minor. Most of the lower division minor courses don't require that you have declared the minor yet. So you have access to those. You also can take your SJSU studies courses once you've completed and earned 60 units. So our area R, which is Public Health 172, our environmental health class, is an excellent class to take. Another SJSU studies class that is also a public health core class is Public Health 135, multicultural health. That is an area S class. So you can take those classes. You can also enroll in electives. And so you have that option. So you want to look at your public health prep courses. You want to look at your transfer credit report, and this is really important. On your transfer credit report, you will want to look for, on the right-hand side for what it came over to San Jose State University as, you will either see PH 67 for your statistics class or Stat 95. Either of those work for our lower division statistics articulation. So if it's showing Stat 95 for PH 67, you're fine, you've met that requirement. And then you want to look for CHAD 70 in your transfer credit report. That is the articulation and equivalent for Public Health 15, lifespan development. So if you see 15, great. If you don't see 15, look for CHAD 70. If you see Public Health 67, great. If you don't, look for Stat 95, and those should show up in my progress for you. If you've taken an Intro to Public Health course, and someone asked this in the chat, because the class is new to us, we only have a few automatic articulations. I think one of them is at Foothill. So some of you will see that automatic articulation. If you don't see an automatic articulation for Intro to Public Health, Catalina's asking, will our advisor let us know what classes to register for? That's what this is right now. I'm letting you know what classes to register for. So if you've taken an intro to public health course, and it's not showing up as an automatic articulation, reach out to us through the public health advising email address, which someone can put in the Dropbox for us. A note, Psych 1 is not an articulation for any of our preparatory classes. So if I recommend you take a picture of this sheet. This is also the information that shows up in the blog and on our website. So if you have not taken an introduction to public health class, you must enroll in Public Health 99 in fall 21. If you have not taken Intro to Public Health, you must enroll in Public Health 99, Intro to Public Health. And you have both an in-person option and online options. If a classroom is named like Health Building 407 or Bacardo Business Center, that means the class is in person. If it just says online, it's online, and it also will show you, if it shows a date and a time, that means you will meet live during those dates and times, like Monday, Wednesday, noon to, or whatever, we have new times now. So, but whatever those times are. So those will be synchronous. If the only classes that are asynchronous, which means that there is no live time that you have to be there, you do the work on your own, those will say both online for the date and time as well as for the location. Okay, if you have passed 60 units, if you're at 60 units or more, you need to take the DSP or directed self-placement exercise. And if the directed self-placement exercise guides you to Public Health 100W, that is another class that you should absolutely be enrolled in fall 21. It's also an Area Z class. So 100W, if you've taken and they recommend you take the 100W from the DSP, directed self-placement exercise. If the directed self-placement exercise recommends LLD 100A, take that class, and then the next semester you'll take 100W. Everyone in here should be taking Health Team Building, Public Health 102. That class, there are many sections for it. I'm not sure if these are updated, but take Public Health 102, any section of it. So 102, and then these, you must take 165A if you are graduating in 4 semesters. If you're graduating in 5 semesters, so you're taking 12 units a semester, you wouldn't take 165A until next semester. But if you're graduating in 4 semesters, 165A, which is a 1-unit course and is our public health leadership series. Some other classes that we recommend then, if you're at 60 units, you can take epidemiology. In fact, if you are in the population data science concentration, you absolutely want to take 161, which is our epidemiology class, and biostatistics 167. So those are classes that you want to take for population data science. For community health education, you want to make sure that you've taken 99 because you then need to take 104, which is community health the next semester. But these are some other options. You can take your health communication class, the biostats, and then we have an elective, which we're really excited about. This is food systems in public health. So this is one of our concentration classes, but it's open to all public health students. So you can also take that. All right, if you were enrolled in something besides those classes, don't leave today without talking to an advisor, a public health advisor, a peer advisor, or a faculty member advisor. So who is your advisor? If you're CHE, Dr. Angie Buckner, and this is her email address. If you're population data science, that's Dr. Dougan, and this is her email address. Everyone else, you have myself and Professor Alyssa Shaw, and this is how you get in touch with us there. And also some of you will have Dr. Jenny Zhang. So a note, as I said in the chat box, we in public health, we do not offer advising over the summer. Our Success Center colleagues, Talisha Teague and those folks, they do advising over the summer. So if you have any questions that you feel concerned about, confused about, I can stay and answer questions here today. So can our PHPAs. We even have so we can do that. But if you need additional help over summer, that is the place to go.
And
So
you'll be able to see us after June 1st for advising everyone.
Perfect. Thank you. And also you will be registering, your dates will come out on June 4th, and then as early as June 7th, I think is when your registration actually starts to happen. Is that correct, Talisha? She froze.
I'm sorry, I was answering a chat in the question.
Oh, sorry. Their registration dates come out on June 4th, and
Yes.
then they begin on June 7th.
Correct.
Okay, so Intro to Public Health, a writing class, your team building class, if you're graduating in 4 semesters, your leadership series, if you're in population data science, EPI and biostats, those are the classes to take. You also, if you're not in PDS, you can still also take EPI and biostats. All right, I think the leadership class is online, but you'll have to check the schedule. So when the schedule will come out and it will show whether it's online or not. Okay.
For those asking about nursing, you'll have to check in with the nursing department, but it will not be possible to change your major this fall. They have a very specific way, pathway on applying for nursing, so that probably won't be until maybe fall 22 if you're lucky. So just be careful with that. Just as a reminder, everyone, if you are done and everything and you've taken a picture, do not leave the meeting. Remember, you do have to get your attendance checked for this pre-orientation today. So if you are done, go ahead and press the leave room button once you are finished, and you are going to leave the breakout room to go back to the main session. Renee in the main session will have an exit survey for you to complete. You must complete that exit survey in order for you to get credit for this pre-orientation, or the university will not recognize you attending this orientation, and you might lose your admittance. So just be careful. Do not leave the meeting. If you're ready to go ahead and press that leave room button to go back to the main session, and then Renee will have that exit survey for you. Sorry, Felicia.
No, nothing to be sorry about. So we're also here to answer your questions. So I see that there have been some going on. Dr. Dougan highlighted that, yes, all of the leadership courses are online for fall of 21. And yes, if you wanted to be all online, you have that option in fall 21 with our public health core classes. There's also opportunities to be in person if you would like. Dr. Dougan, most of our 100Ws are online. A few are.
100W. Yes, you have a menu of options. You can do online, you can do in person, and you can also do online asynchronous. So it's one of the more flexible ones.